festive season quickly approaching and healthcare facilities then also gearing up for what is a predicted fourth wave of COVID-19 infections. Over the past few months, South Africa's COVID-19 transmission rate has remained stable. The Health Department calls for caution and for everyone not to let their guard down. To talk more about this, we're joined by health journalist Laura Lopez-Gonzalez. Laura, we've just come out of election season. You would have seen the visuals of the rallies and lack of social distancing, no mask wearing, and yet there was no talk of a fourth wave. Many people will be asking why the prediction around mid-December to early January.
Right, and we know that the elections didn't lead to a spike in infection. What we're really seeing here, I think, is some cautious statements from the health department and health experts about a possible fourth wave in December as we go into the festive season, also in the beginning of next year. But these statements are a little bit more cautious than they have been previously. For instance, UCT professor Johnny Myers saying recently that he thought a fourth wave might not be as bad as a third wave, but yet wouldn't be the best possible scenario because our vaccination rates continue to lag. UCT demography professor Tom Moultrie tweeting recently that he thought in the absence of the rise of a new variant like the Delta that we saw or the Beta that we saw, we might be dealing with what he described as muddy, sloppy surges, but not a full-blown wave. So people, I think, are very cautious in terms of making big, bold predictions about what a fourth wave might look like. But nonetheless, I think we're seeing a lot of health officials urging people to get vaccinated, urging people to continue those social distancing measures as we head into the festive season.
And what are health officials predicting will be driving this expected fourth wave?
I think it's still a little bit unclear what the wave or these sloppy surges, depending on who's making the prediction, might look like. And I think that's in part because we've seen both the sort of second and third waves really be driven by these rises of these much more infectious variants. So it's a little bit unclear how much the variants were to play for those surges, plus the lack of vaccines that we had at that time, and then again our social distancing measures that we take as people. So I think it's a little bit difficult to say what exactly the surge will look like and what are sort of the components that might drive it. Again, I think the big message here is that if you haven't been vaccinated, now is really the time to do it as we approach this festive season. We have more data from Discovery Health coming through that shows the incredible risk that people who are not vaccinated take when it comes to COVID-19. Unvaccinated South Africans, Discovery Health data is showing 5 times higher the risk of COVID, 20 times higher the risk of dying from COVID-19 complications, rather. So really the message is vaccines are safe, they work, and really now is the time to get one if you haven't.
Health journalist Laura Lopez-Gonzalez, thanks for your time tonight.